A couple of points. The United States Constitution provides the federal government, as opposed to the state government, with very limited powers. Those powers are very broad in those limited areas, but nonetheless, the federal government is limited to regulating interstate commerce, for example. They're limited to declaring war, so on and so forth. Those powers not assigned to the federal government are reserved or assigned to the states. The idea of socialized medicine in the United States is a vast expansion of federal authority. It will have well-funded and articulate legal challenges, if enacted. With respect to some of the points that I addressed earlier, the expansion of Medicaid, I don't see any constitutional problem with that. I do see problems in the area of travel insurance because there will be some cost shifting involved. Medicaid does not sufficiently pay the claims as it is. If you're increasing the population that is covered by this program, the hospitals are going to shift their cost recovery efforts onto the remaining private payers, including travel insurers. With respect to public insurance, or the so-called public option, to regulate a market as authorized by the Constitution is not to participate in that market. There's a difference there, and I think a matter of degree is important. State law, in fact, prohibits the selling or the transfer of health insurance policies across state lines. Given this situation, it is difficult, I think, to argue that health care insurance is a matter of interstate commerce and subject to federal authority. I have concerns about the constitutionality of public insurance in the United States. With respect to the mandate that I addressed briefly earlier, whether it be employer or employee, or employer or individual mandate, there has never been a requirement, according to the U.S. Constitution, that citizens of the United States purchase anything. This is especially true when we're talking about something, health insurance, that by definition most of them won't need. They'll need it eventually, but the idea, of course, behind insurance is that you have a pool of insurers paying for claims to cover the fewer claims that actually are made. In those states where there is currently a mandate to purchase insurance, such as Massachusetts, I believe, this authority comes from state law, not federal law. And the way we look at it is that if a person in Massachusetts or what have you did not like the obligations of Massachusetts law that they purchase this insurance, they could conceivably move. If it's a federal law, there's no place to move to. The important question with respect to U.S. healthcare policy is, what is the goal that the Democrats or President Obama is trying to achieve? Is it to increase the size and scope of the federal government? If so, I think it is a certainty that the proposed legislation, if enacted, will succeed. Is the idea that this legislation will contain costs? If so, I think the likelihood of that happening is arguable at best. We've had 60 years of Medicare and 30 years or so of Medicaid, and neither of those programs has contained costs. They have simply paid some costs and shifted other costs onto private payers, such as yourselves. If the goal is to provide more effective care, I'm skeptical. Anecdotally, everyone's familiar with the swine flu, the H1N1 disease that is sweeping the globe. The United States government has taken upon itself the responsibility of approving and distributing vaccines for this vaccine. Distributing vaccines for this illness. There have been numerous problems. It is becoming a political issue for the authorities. that a substantial portion of the population has not received this vaccine, although we're in the heart of flu season. Given this experience with the swine flu and the vaccination of it, I think the public is somewhat skeptical of permitting the authorities greater control over their healthcare delivery. Thank you very much for hearing me speak today, and I appreciate the invitation. Thank you.